As more concerning news starts to appear, I am getting very worried for both the medical as well as the pharmaceutical industry in terms of the science. One of the problems is that if you are gambling on understanding the science, and if you trust the people who are giving you the science and they get it wrong, everybody is therefore plagued by the same outcomes. And at the moment, there are more and more signals, and I'm important to say because this was just censored, signals that indicate there seems to be a trend leaning towards the risk of COVID vaccines and cancer. Now, just recently, anybody who talks about this stuff gets stamped on because there is always the point there is no evidence of. And I'll just give you an idea as to the research, but I want to take you on a historical journey for you to understand why I think that this is the wrong approach to be taken by industry as well as by the medical fraternity to not ask these questions. So here we have a study that was published on the 26th of September, 2025. So this is just 3 days ago. And it was a large population study in South Korea, looking specifically at the 1 year risk of cancer associated with COVID-19 vaccination. Now, I had just recently done a presentation just a few weeks ago where there was also a signal that appeared to be there in terms of Italy as well. And so this is why I'm saying that these are two separate countries that have taken a look and have seen some kind of signal. Now, it does not mean there is absolutely a direct correlation. However, this is a very important signal that needs to be investigated. Okay. And when you look at the paper, just to give you an idea as to what they look at, is they were looking at a population based view, 8.4 million people between 2021 and 2023. It based it on their COVID 19 vaccination status. And it looked at a number of cancers across the board: gastric cancer, thyroid cancer, prostate cancer, breast cancer. And it looked at the fact that there was significantly increased risk 1 year post vaccination. They found that the DNA based vaccines, the viral vector vaccines, were associated with the highest risks of some. mRNA as well was linked to higher risk of others. At the moment, the DNA vaccines are no longer as available. However, we still have access to the mRNA vaccines. And their conclusion was, given the observed association between COVID 19 vaccination and cancer incidence by age, sex, and vaccine type, further research is needed to determine whether specific vaccination strategies may be optimal for populations in need of COVID vaccination. As subtly as they can, they're trying to say that you need to look at this further. This is not something that you should ignore. You may ask, why did they do it? Well, largely because I said, in terms of, we further hypothesize that COVID 19 vaccines may potentially be associated with cancer risks. However, real world data was insufficient. Nobody's studying it. They then took this population based retrospective study looking at the cumulative incidence and cancers 1 year after COVID 19 vaccination. And again, you can see this is one of the earliest examples of doing this kind of study, looking for the link, because so many people have been saying it. They've been talking about all these various points, and why wouldn't you look at it? And this is the point that I am saying to industry. If anybody from industry is listening to me, let me warn you on this. if this turns out to be accurate, and this is not just a trend, and you guys sat on this and didn't investigate it, the public will never forgive you. And I would not disagree with them, because this is not just about the big companies. I'm making a call specifically to people who are in the industry. You are not getting any benefits directly from any of these major companies. You're sitting on the sidelines, but you will be tarred with exactly the same brush if you continue to pretend there is nothing happening here. Again, I say, it is not necessarily that there is a direct link, but goodness gracious, two separate countries are indicating what could be a trend. You have got to take it seriously. And every country, from a public health point of view, should be studying this in great detail. So I'm going to give you a historical lesson, because I took some time today and I had a bit of research around the history. And what had happened is that I had shared a specific image that people got very, very upset by, and so they censored the content without reflecting on what it was that I was saying. So I'm going to try and explain it a little bit better, and hopefully they won't censor it again. And I'll show you the image that that caused the problem. And you can tell me if I was too much to the point here. So this is the image that caused the problem. Same arguments about cancer, different products. And it's making a very clear association here. And it was considered offensive or misinformation, and so it was taken down. You have to understand why I said what I said, and maybe I didn't explain it clearly enough. So let me try and explain what I was saying. So many years ago, there was an issue with tobacco, smoking, and cancer. And here is what the history, based on my discussions with ChatGPT, here is what we pulled together as a timeline for you to understand how the history operated. So in the 1930s to 50s, there were some studies in 1939 looking at the link between lung cancer or cancer and smoking. And the tobacco companies flatly denied causation. So this is where we are at the moment, where when I ask the question, even when there is evidence as what happened there, and there was a trend, there is a flat denial of causation. They say there is no evidence that you have that this is causative. And not only that, cancer rates are, say, going down, but so many people have died. Whichever way you take it, there seems to be a trend. I think it needs to be investigated, but at the moment, industry is flatly denying causation. Okay, I understand that. That's what they're supposed to do. And at that time, with regards to tobacco, they insisted that the data only showed association and not proof. It says the argument correlation versus causation. This is from the 1930s that they are arguing this central talking point for decades, which is where we are now. And so what I'm saying is that we are seeing a trend. At the moment, there is only a small uptake with regards to boosters. This is the time, because there is now not a major risk if people aren't taking it anyway. Please, there is no excuse not to do the research. You've got to clarify the research. The problem is that if the same people who are doing the research are the same people who didn't do the research, will you trust the outcomes that they have if it shows that there is no link? That's the problem they're going to have to face. The longer that they have gone on with this, the harder it will be to build public trust. Going on in terms of the history, in 1953, as the evidence mounted, so this is like 12 years after, so then the US tobacco companies set up a PR campaign. And they started publishing frank statement to cigarette smokers. Tobacco was not proven harmful. They were funding independent research to find the truth. But in fact, they were only buying time. So this is the 1950s. So we've already gone, in this case, about 12 years since the major research has gone on. So they then started to fund research, but it was designed to confuse, it wasn't designed to clarify. And this is the reality of the history, is that they paid scientists to emphasize alternative causes of cancer, air pollution, asbestos, viruses. Oh my goodness. I tell you, it's fascinating. History repeats itself. You will be hearing lots about microplastics, radiation, all kinds of stuff as being the cause, and that is about manufacturing the doubt. This is a history. Remember, I'm telling you the history because you need to see how history can sometimes repeat itself. So then there was the manipulation of the media messaging. This is all from the 1950s. They did sponsored articles about smoking was glamorous, calming. So this is when all the movie stars would smoke. Doctors would smoke, like more doctors smoke camels. So all of this was done, as well as suppressing unfavorable studies and promote industry funded science to counter independent findings. I tell you, the more you look at history, the more fascinating you get. And then they did the legal and political lobbying, which you would expect. They hid the addictive characteristics of nicotine. Then they shifted the blame between light and low tar cigarettes. And then this is the, I mean, tell you, look at this. In 1994, the US congressional hearings, CEOs of 7 major tobacco companies testified under oath that nicotine was not addictive. And this is what they said, a huge thing that they said at the time. It revealed decades of deception. And this is 1994 into 1998. This started in 1939. Okay? This is pretty serious stuff. Now, the problem is that I have a feeling that the hope is that the longer this goes on, the harder it will be to correlate and tie stuff together. But the problem is the question is still in the public's mind. And based on what I had done before, as I said, that I'm saying these things not because it's a surprise to me. It's because I'd said this over 2 years ago. The science was just too specific for someone to ignore it. This is what I was thinking about. And so there's a link in the description. I think it's free at the moment for you to see what my thoughts were at that time. And a lot of those thoughts are still relevant today. So here is the reality of what we're facing at the moment. And this is why I am kindly advising those who are listening, who understand and have some influence, please do not ignore this one. This one is definitely going to blow up if you ignore it. Here were my potential links. I had 5 links, and there are more now. It's not just these ones. These were the potential links that I had 2 years ago. And I knew that even one of them could be significant, but all 5 together, this is going to be a nightmare. So here what I think is going to happen, because a lot of people don't realize how this is going to play out. It seems that, and I said this before, it's not turbo cancer as they've described. I don't think is the best terminology because it makes it seem as though the cancer is growing fast. I don't think it's that the cancer is growing fast. It's that the cancer is spreading fast. So it's almost as if, I'll tell you, one of the most serious cancers that we've always had before the pandemic was a melanoma. It's a skin cancer. And the reason it is so serious, so lethal, is because it spreads, it gives metastatic spread very early. So you may see only a little spot and it's growing a little bit. By the time that a biopsy is done, there's already spread to the liver, brain. It is one of the fastest spreading metastatic cancers that we have. The question is, suppose we see most cancers now taking on a similar pattern where even from a small cancer, it evades the lymphatic spread and starts to spread metastatic spread very early on before there are even symptoms. This is what I suspect is going to be the reality, because the problem is that by the time the patient presents, their symptoms are related to advanced disease. It has already gone to the brain, to the lung, to the, well, not so much the gut, the bones, and so all you can do is palliate with radiotherapy or chemotherapy, because you no longer have the surgical option to completely remove the cancer and therefore bring curative outcomes. This is already a nightmare because I can't even think of how you screen for that. How do you screen for that? How do you know? People are well and then they have advanced cancer, metastatic disease. There's nothing you can do. You can't, they don't come with the normal symptoms. Normally, somebody with lung cancer will be coughing for a while, worsening cough. They may have a little blood. You do a chest x-ray, you see a tumor, you find that it has only spread to the lymph nodes. You can take out that tumor, take out the lymph nodes, give some chemotherapy, curative solution. But if when these patients present, they're not even presenting with a cough, but presenting with a brain tumor that has spread from the lung, what can you do? That's the reality. And this is, in my view, why I'm saying, please, whatever you do, whether you agree with the science or not, you had better not ignore it. Just do the research. Confirm conclusively that there is no link and explain why. But do not ignore it. The public will never forgive you, and I will make sure they never forget. This is serious stuff, and there is a responsibility that exists outside of industry and politics that needs to step up to the plate and make sure that they are advocating for who they're serving, which is their patients, not the regulators, not the government. You are serving your patients. Don't forget that. And if you forget that, I suspect that this will be the end of medicine and healthcare in the form that we have it, because public trust will be permanently shattered. Just my thoughts. I hope this makes sense. And I don't think that this question is going to disappear. Have a great evening.